Good morning, everyone. I think we're ready to get started. Thank you for coming. My name is Lisa Peterson. I'm the Deputy City Manager, and I'm also Chair of the Community Benefits Advisory Committee. And we're really excited that we're at the at this place where we're now having our second information and question and answer session about the Community Benefits Planning Grant RFP. And we're very excited we're at this point. I want to just emphasize once again the proposals are due on February 15th. We're here today to provide some brief overview statements and sort of some background, and then there'll be time for people to ask questions. And the questions we're going to try today to answer those questions today. Our answers will also be put up on the website. If we feel like there are some questions that we may need to just regroup a little bit to make sure that we've all got it really totally correctly, and then we may be putting it up on the website. I hope you all know where our website is. It's on the city homepage, just /community benefits. So www.cambridgema.gov/community benefits. But if you just Google it on or search it from our website, you should be able to find it. So our time today is that we wanted to talk a little bit about how we got here. So background and overview of the community benefits process. We're going to do that very briefly. And then we're going to talk more detail about the planning grant request for proposals, the selection criteria and the goals that we're trying to achieve and requirements. And then the rest of the time will be left for questions and answers. And then there'll be time here, since we have until 11, that people can just have coffee and informally network. We are not facilitating the networking or the partnerships, but I just encourage people to get to know who else is in the room, and because a lot of this is about developing strong partnerships. So I just encourage you to do that. So with this, now I am going to hand it over to Wendell Joseph, who will be opening it up.
Thank you very much, Lisa. Good morning, everyone. Once again, I'll just take us quickly through the background of this process and how we got to this point. This is an effort that's been many years in the making. It started back in 2010 when the first set of community benefits funds were pledged to the city. Fast forward to 2015, that's when we saw the creation of the actual community benefits fund, where all those monies were deposited and held, designated for community benefits purposes. That's also when the community needs assessment began, which preceded this particular process. Many of you guys are familiar with it and were involved with it. And that's also when the ordinance was adopted, which was actually what created the committee. Fast forward to 2017, the community needs assessment was completed. It was adopted by City Council, and the committee itself was formed. So over the last year and a half, almost 2 years now, this committee has been working on this process, on putting together the framework for how we would receive applications, how we would review it, make recommendations to the city manager for how those funds will be distributed. So it's, we're pretty excited about where we are at this point in time. Again, real quickly, over about $23 million has been pledged to the city, designated for community benefits purposes. Most of those monies have been pledged to the city from MIT. We only have $7.5 million available right now. These funds are tied to various stages of development. So as future projects begin their construction, come online, that's when the additional monies will be kicked in. Fortunately, due to the nature of the development process, we're not sure exactly when that will be. Sooner would be better than later, but unfortunately not clear at this time. The guiding principles for community benefits funding has been a very important a framework for us as we've thought about this particular process. It was first established by City Council and also expanded through the community needs assessment process, and it's broken down into four categories. There are 17 principles, and they're broken down into 4 different categories. One talks about the importance of being able to frame these needs thoughtfully. The second talks about building on existing assets and programs, and that recognizes that there's already a lot of good stuff happening in Cambridge, both in terms of programs but also people, and being able to tap into those assets and enhance them. We've also got some principles around promoting holistic approaches, innovation, and collaboration, which has been a very important key in this process, and just why we are encouraging organizations to come together and think of really creative and innovative ways of addressing these needs. And providing services at that. And also being able to simplify the application process to try to make it as transparent and inclusive as possible, but also provide the opportunity for the renewal of grants for those programs that are just really doing quite well. So that's just like really broad overview of like how we got to this particular point. In terms of the process itself, at this point, this is our second informational session. The planning grant proposals, as Lisa mentioned, are due a month from yesterday. So hopefully you guys are hard at work in putting these proposals together. We expect to announce and award the grants in April, and that is when this 6-month planning process, planning phase, would begin, and sometime in November we expect the main portion of this process to begin, which is the 3-year implementation phase. So I will also just run through our goals really briefly. Again, as I mentioned, the one of the big goals for us was to be able to really push the boundaries for what partnership and coordination and integration of services looks like in the Cambridge ecosystem. And again, one of our guiding principles asks that we do just that. So the nature of the partnerships is that we would have a lead organization, which is a Cambridge-based organization, and a team of supporting organizations that either can be Cambridge-based or based elsewhere in the metro region, working together to provide needs that go directly to Cambridge residents. And thinking about, again, the complexity of needs and also the interrelation of them, the short-term goal is really to be able to enhance connection to services. The idea then is, if organizations come together in creative ways, it can also open up opportunities for families to be able to tap into services that they need in ways that might be a little bit more beneficial than might currently exist. And also long-term goal is really just to be able to enhance child and adult resiliency, to be able to help families be a little bit more stable, and also realize a measure of systems level change. So really thinking about, well, how does the nonprofit sector work together in collaboration with the private sector, the universities, the city, et cetera. Top tier needs. So these are the needs that were identified through the community needs assessment process as being some of the most pressing needs in Cambridge. The way that they were prioritized, though, the top tier needs, affordable housing and homelessness, financial security, behavioral health, were identified as the ones that were the most pressing in Cambridge. And so in order to maximize the impact of this process and of the community benefits funds, the committee decided to focus on the top tier needs for this initial round of funding. And I mean, Ellen will speak a little bit more as to how that could look like across different proposals. But again, the idea is that each proposal should be able to address all 3 needs, top tier needs. All right, a little bit more about the target population. There were some questions that came up in our last informational meeting in November as to, okay, well, how many families falls into this particular category. The target population we've identified as families with children that are low income or living at or below the poverty threshold, especially those that are headed by single women. And we focused on this particular population through the, based on the data that came out of the needs assessment, the community needs assessment, and also other information that's available about Cambridge today. And so if you look at the RFP Questions and Answer document that's available at that back table, I flip to the second page. We were able to, after the November meeting, narrow down or have a rough estimate of how many families would fall into this particular population. And we do have to credit Cliff, who was able to pull this together for us. So we estimate that there are roughly 2,300 families in Cambridge that would fall into this particular category of their target population. And of that 2,300, roughly 1,000 are families that are headed by single women. And so I just want to point that the reason why we got to this point is that even though families that are headed by single women represent roughly 13% of families in Cambridge, but they represent, let me make sure I get the number right, 43% of low-income families. So 13% of all families in Cambridge, but 43% of low-income families. So that's for families that are headed by single women. So it's just to, again, provide some additional clarity on as to how we got to this particular point and why we chose, why we define a target population as such. Some extra information about the target population. Again, just to give you a sense of the range of families that could fall into this category. So we have here information about free and reduced lunch in Cambridge Public Schools. As you can see, over the last 4 years, the population or the total number of students in Cambridge Public Schools has, increased slightly, but the share of students who qualify for free and reduced lunch has roughly remained the same. Conversely, we've also got some information available about CHA, the Cambridge Housing Authority, and their household demographics. As you can see, a overwhelming majority of families of households that CHA serves would fall under this category of our target population, in that they are at the 50% AMI or below income level. So again, our intention of sharing this information is to affirm that there are many different families that are represented within the target population. So the focus is not necessarily to focus, the goal is not necessarily to focus on just Cambridge Public Schools and their students, or just CHA and those families, but just to, again, provide some clarity as to the range of families that fall within our target population. All right, with that, I will turn it over to Ellen.
The green one or this one? Right one. All right. Hi, everyone. I'm Ellen Semenoff, and I'm the city's Assistant City Manager for Human Services. I think I know most of the people, but not everybody in the room. We want to just walk you through a few of the items in, in the RFP that we want to highlight specifically about the planning phase and about the selection criteria for the planning grant proposals. Let's see. So just a reminder here about that, as Wendell referred, there really are two phases. You are about, hopefully, to submit an application by February 15th at noon for the planning grant, and the application for the planning grants will be reviewed by the Community Benefits Advisory Committee members, which will ultimately make recommendations about the selection of up to 5 partnerships, and those partnerships will be eligible for grants of up to $30,000. As a part of the work that those partnerships will do once they've received an award is to develop the very specific plan for implementation during the 6-month period. So there will be, as you may, I suspect all know, up to 5 planning grants, and there can be up to 5 implementation grants. It is our hope that the planning grant applicants will then be successfully moving to the implementation phase. So the plan is also that the partnerships who receive those planning grants will be using those funds and the 6-month time frame to develop that more detailed plan for implementation. So the expectation is, and we'll walk a little bit more through that, what you need to be able to present in order to get a planning grant, and then the understanding that a lot more work will go into, once you have a planning grant, the development of the detailed plan for implementation. So I want to walk through with you what we're looking for, the selection criteria. First, the proposals, and Sandra will walk a little bit more through the application process. You need to address each of these 8 criteria in your proposal, and the application walks you through where that is. But these are the basis of the selection criteria. In number 8, just want to kind of reiterate that we understand, which is that we expect that there will be an initial articulation of the anticipated outcomes and the plan for service, and we expect that that will continue to be developed over the course of the partnership. We do not expect that the sophistication of the initial plan would be the full-blown, very detailed plan for implementation. The expectation is you will bring forward something that we can understand what this looks like, and the idea would be you would then be using those 6 months supported by the evaluator that we will bring on board. You will then be developing the much more specific and sophisticated plan for implementation. Also, while we expect that and require in number 2 that the planning grants address all top-tier needs. So all 3 of those needs need to be addressed in the planning grant. And while we understand that the clarity of exactly how all of those will be addressed may be somewhat less clear in the planning grant phase, it is a requirement that all 3 needs are addressed. And I think it's pretty, or we hoped it was clear from the application. We don't assume that every family that is being served by the partnership may in fact have a need for services in all 3 areas. But some of your families will have needs in those areas, and therefore the plan needs to be able to address how you will be addressing those needs. And we understand that you may need some of the time that you will be spending in the planning, once you have a planning grant, will more specifically articulate that. But just to reiterate, all top-tier needs, there needs to be in your planning grant, one of the criteria for selection is your plan to address those needs. And it may be, and we articulate in the application that you may have an in the application to some extent, and in the FAQs, which were posted on our website and are in the back of the room as well, that there may be some difference between who is a partner and who might be a service provider. So in order to apply, there have to be at least, and Sandra will talk more about that, 2 partners. And it may well be that in addition to 2, 3, 4, whatever the number of partners, that your expectation is that in addition to having partners, you may also be contracting with a service provider who is not a full partner, who is not an entity that's expected to be completely integrated in the work, but that may be able to deliver a particular service. So I'm going to make this up so that it's not. So if, for example, you anticipate for some reason or another that you do not need or do not have a full partner who is addressing the financial stability piece, you believe you have the capacity to manage some of that, but you want an employment partner that is not, you want an employment service related to the work that you're doing, so that you might be contracting for services related to that, as opposed to having a fully integrated employment partner. Not sure that's what you would do, but I picked that just to give you an example of the requirements of partners, and the application talks about what it takes to be a partner and what's the combined vision of the partners and what's the way that the partners will share responsibility. That maybe you are not required to have every service that you are describing that you will provide be delivered by a partner that is integrated at that level. And it could be that you are actually looking at a fee-for-service arrangement with that partner, as opposed to the integration that we anticipate. I should say service provider, not partner, trying to draw a distinction here. And I think if you look through the RFP, at a fundamental level, we are really asking that through this RFP, that we're looking for a different level of integration of partners in the delivery of service. And so the expectation that partners will change some of the way in which they currently deliver service in order to be able to provide integrated service. It is possible that one piece of the service that we're asking for in addressing the top tier needs, you may not have a partner integrated at that level. Can answer more questions on that, but we just want to be really clear. You need to address all of the needs, but you could end up addressing one of the needs through a service connection rather than through a deep partnership. But you need to be able to identify that as a part of your planning grant proposal, and then more fully develop it through the planning process if you're selected for the planning grant. And if you end up in a model which has a service provider, then I think the distinction between who's sitting at every planning table, who's committing to the way in which they will deliver services differently, that's in some measure the distinction between what is a partner and what is just a way of delivering the service. Because they may not be, when you look at what, as Sandra walks through the application requirements, what they're committing to as opposed to what your core partners are committing to. Just want to see if there was anything else. We can go back if there are questions about any of the other selection criteria.
I forgot to say at the very beginning, I just wanted to tell everybody that this is being audio and video recorded, and certainly before you ask questions, you should sort of know about that. But we will be replaying this at some point on that people will be able to have access to the presentation. So,
thank you. So this is I get the option, the requirement to walk through the more technical pieces of the application submission, and we're going to do it in a somewhat less technical way, going off of the PowerPoint. So I need Wendell's help because we're going to look at the actual submission requirements. So what we will cover in the application requirements, before you actually switch, we're going to walk through the title page. We're going to walk through the approach to the target population, partnership, partnering organizations, and lead org. We're going to walk through the initial plan for program model and additional documents. So when this gets posted, you'll see that there's a link where application is. As Lisa had mentioned before, all of this information is on our website. If you go to the Cambridge/community benefits, or you could access it through CDD's website on the project page as well. Everything that we're talking about today is either posted already or will be posted. The application requirements that I am going to walk through right now is a PDF that is currently on our site. Cool. And it's really detailed. You've probably had a chance to look at it already, but what we want to do is to make sure that we can go to page 2, please. We want to make sure that we actually have an opportunity to walk through it, to raise the very specific points so that it gives you an opportunity to think of what questions you might want to ask in this forum or questions that we might need to answer for those not in the room today. I hope that it's not entirely redundant, but let's walk through it. Excuse me. So there are limitations on the scope of what is going to be submitted, in that the title page, it's a 250 maximum word abstract that summarizes your proposed project. So as the partners come together with the lead organization, you will be identifying what the title of the project will be, the contact information for the lead organization, who will be responsible as the primary contact for submitting this application. And if there is a different person that is the primary contact for the community benefits project, that person should be identified, but we would expect that that would be the contact person who is signing off on the grant agreement, the executive director or president of the lead organization. As far as the approach to the target population, partnership, and organizations, there's multiple sections, and it is all part of a 5-page maximum submission. We did not put out an application that says check the box, give us the answer to this question, that question. We put it in a freer form way so that you can address each of these components in your application within that page limit. So for the target population, we want to make sure that you discuss the common needs, challenges, strengths, gaps, and opportunities of the community and the family that are intended to be served. We want to make sure that you describe the demographics of the families that will be served by the overall partnership. And when we get to the overall partnership, we're looking for you to tell us what your initial common vision, shared values, and guiding principles for this partnership will be. As Ellen indicated, not all of the planning for implementation will be fully fleshed out, but the common vision is important for us to have an idea of how you plan to walk through the overall partnership and implementation. What it means to make a measurable impact on all of the 3 top-tier needs, and how this partnership will influence and impact those needs and add value to the community. We want you to describe the nature of the partnership and how decisions will be made, because while there is a lead organization that is fiduciarily responsible for the grant and also for bringing the partners together, we expect that all of the partners will work together and that it will be a strong collaboration. So we want to understand how the partnership will work together. And then also to describe how many families each partner currently reaches and how many families it anticipates. So we're looking for what the incremental impact will be. I think we say it multiple times in the RFP in some form or fashion, but we're certainly looking for systems change, looking for how we as in the different applicants and in the partnerships can come together in a collaborative way to build sustainable partnerships for reaching and meeting the unmet needs going forward. For each partner, and I'm skipping down to that last section there, we would want each partner to identify their individual information for that partner organization, how the leadership of each partner organization will be involved in the total partnership, and then the past experience dealing with partnerships, so current or previous. The second to the last bullet point, really important. How does each partner organization currently engage families, and how will it engage new families? And then describing how each partner organization addresses equity and inclusion within their own organization. And as Ellen alluded to, when we're talking about these requirements for each partner, we are talking about partners, folks who are going to be signing on to this grant award application. That's different than the service providers. So everyone who's going to be a partner committing to that shared vision and collaboratively working together. Okay. For lead organizations, excuse me. So there is an increased expectation for the lead organization, because when we were looking at the last one, in that for every organization and for the partnership overall, in addition to those things, the lead organization has certain heightened expectations as well. So the lead organization needs to have past experience in managing and or participating in partnership, whereas the other partners, we're asking for the participation. We want to know how the lead has managed in the past. We would like to understand the capacity to manage and the history of managing grants and partnership requirements in the past. So whether it's overall oversight for fiscal, for staffing and reporting, and what that organization currently does in terms of maintaining fiscal discipline and controls. The lead organization will have the responsibility of data collection, or making sure that that information is maintained, monitored, tracked, and for the overall partnership. And so we'd like to know that the lead organization has experience in the capacity for handling data collection, or is willing to engage a facilitator to do that as well. The last two bullets are required for all organizations, so I won't reiterate that. What I would highlight from the notes section is that additional partners may be added sometime in between. So you're submitting the planning grant application. You get to work through that. That is the method that we're using to give technical support to organizations so that you can get to the point of an implementation grant. You can flesh out what those ideas are and with a partnership. And so when you submit the planning grant application, you may be aware of all of the partners that you would like to have involved. And as you work through the planning grant, you might find that, well, I'm thinking about this a little differently, or I might need to augment this in some way. So there's an opportunity that additional partners could be added, or that the composition could change as we get to the final plan for implementation. In the initial plan for program model, well, everything that just went before then, 5 pages. I should only hold up one hand. 5 pages, not the 10. But the initial plan for program model is a 2-page maximum. That's where we're asking you to describe the initial plan to develop and implement a program model that is consistent with the priorities of the Community Benefits Committee. We're looking for you to take an innovative approach to coordination and integration of services, and to address all of the top 3 tier needs in doing so. There were a couple of bullet points that I would highlight. We've talked about some of them already, but we're going to want to make sure that you have the potential to respond to the interconnections of the top tier needs, because those top tier needs were not selected in vacuum. They are related, and so we want to understand not just how you will address them individually, but how you will address the interconnectedness of those needs. We'd want to understand how you're able to lead change at the child, adult, and family level, and in the broader systems and structures that impact families and individuals. And then the last piece that I would highlight is that we want to understand how you would encourage creative and collaborative approaches from partnering organizations, and to demonstrate that the voices of the families that are going to be served are engaged, that they're listened to, and that they're represented in your plan for both the planning grant and then on an ongoing basis. And I should be clear, as when I'm talking about these maximums, we're talking about the planning grant. This is not what the implementation plan will look like. There'll be further instruction, I would imagine, as you're working through with the evaluator as to what that will look like and when that is due. Additional documents. if we can scroll down there. These do not count against your total word count or page count. And I don't think I highlighted this, but in the very beginning it does say that it is a 10-page, double-sided, single-space maximum of all of that. So technically 20 pages because it's 10 pages double-sided. Because we are asking for the additional documents and we are not aware of what the size of those will be, that does not get counted against your word or page limit. But we are looking for your planning phase budget, not an implementation budget, the planning phase budget. So where the amount up to $30,000 that you are requesting would be allocated during that planning phase. We are looking for information about the lead organization board of directors, the organizational chart and the staff, and then also the IRS exemption letter that would indicate nonprofit status. If I can scroll to the next part of the additional documents. Also the technical forms, Form 990 or audited financial statements. And the letter of affirmation is a letter that should be signed by each partner. Not necessarily service providers, but each partner who is buying into this collaborative approach and will be part of delivering integrated services will need to sign a letter of affirmation indicating their involvement in the support for this application. So any partner that is referenced. And it should be, I think we reference it elsewhere, that when we're talking about who the responsible party is from the partnerships, it would be either the executive director or the CEO, the president from that partnership. If there are questions after this session, you can direct them to the purchasing agent, and we will post anything that we do have to in response by mid-February. I think the date is February 11th, right? Okay, got it. There are a series of attachments. Maybe we can just display them, but I don't think I need to talk through them in any great detail. But they are standard forms that go along with any proposal submission to the city. So the tax compliance, anti-collusion, wage theft prevention, CORI, and then I will skip to the very last one on here, certificate of authority, that shows excuse me, that you are authorized by your organization to enter into this type of a application process. I'm sorry? For the lead organization. Okay. Alrighty, so if we can get back to the PowerPoint. And go to the next page, page 16. Awesome, thank you. So we've talked a lot about this. I don't mean to be redundant in this as well, but if I can just highlight a couple of things. With the shared vision, we expect that partner organizations may play different roles. And so we're hoping to understand what those are through your application process. We want to make sure that each partner's voice is heard and equally respected, while they may play different roles. We want to make sure that there is a demonstration that there's a commitment to sharing and pursuing resources, committed to engaging families to be served while walking through and developing the planning grant proposal, and also through implementation. We're looking to make sure that there's continuous feedback and facilitating with the families who are going to be served. So a commitment to doing that. And that also, as we're looking for the application, we're looking to make sure that the partner organizations reflect and respond to the needs of the families that are being met. So that is one component. So when we look through the additional documents and the board components, the staff components, the org chart, we're looking to see how the organizations actually reflect the communities and the families being served. Awesome, I'm back to cooking with gas. In the lead organization, just a couple of things to highlight here as well. So that we're looking that there is one lead organization while there might be many partners as part of it, the application, but that the lead organization is going to be the entity that enters into the grant agreement with the city. So all of the required documents, some of which were included with that application, in any other contract that will be signed, is the lead organization. And want to be clear that a lead organization can only be on one proposal. While there may be supporting partners that could be involved in many applications, that would be okay. But if you're going to identify as the lead on a proposal, then that's where you are. Okay. And last, with the lead organization needs to be a 501c3 nonprofit organization based in Cambridge and serving Cambridge families. I think I would highlight and say directly benefiting and serving Cambridge families. The lead partner, lead organization needs to have the data collection experience and capacity and willingness to engage a data coordinator or to be able to facilitate whatever that data collection requirement of the grant will be. The lead organization will also need to be willing to support any required evaluation activities. We're in the process of engaging an evaluator who will work along with grant applicants and proposers during the process, but there will be ongoing monitoring requirements for evaluation as well, and so that would be under the responsibility of the lead organization. And then also the lead organization would need to have the capacity, the ability to act as the facilitator and the convener of partnering organizations. So when we asked earlier on that you're demonstrating the ability to have managed or have worked in partnerships in the past, and the capacity to handle that on multiple fronts, whether it be in staff oversight or fiscal or in convening or data collection, we're going to be looking to the lead organization for those things. And then the last thing again with it's a requirement for all partners, but that the organization reflects the families and the communities that they serve. It's a Cambridge-based organization. We've seen the demographics for Cambridge, and we'd like to be able to make that correlation back. I think that's it. Forward though, yeah.
Okay, wonderful. So now we get to the question and answer period. There's a number of us from the committee, the Community Benefits Advisory Committee, that are here. Thank for other people for attending. Again, we'll try to answer your questions today. If we feel like we need to talk a little bit more, we will, to make sure that we're giving a perfectly accurate answer. We will put it on our website. We're going to try to put it on our website as soon as possible, but the latest that we'll be putting questions up will be February 11th. So that means you need to, if you have additional questions that come to you that you want to put in writing, if you look at this, you could put them in, you can email them to purchasing@cambridgema.gov, and we will, if a question comes, you think about it tomorrow, you can put it in up till the 11th, and then, I'd like you to we will post answers up through February 11th. The earlier you get the questions in, the more fully we're going to be able to answer them. Questions we're receiving on the 11th might be difficult for us to really fully answer if they're complicated questions. So just try to get your questions in. So let's open it up now if people have questions. Or are we all so perfectly clear? That's great.
Sadly, we don't have a wireless mic, so
yeah. So because we are being
being
audio recorded, we would ask for people to use the microphone. So we'll have the benefit of that if Thank you.
Hi, good morning. My name is Jyoti Sinha, and we recently started a South Asian Worker Center where I'm trying to organize a South Asian community. Working class people in and around Cambridge have been working with Rinch Tower, the 3 towers, and we've done excellent work in this 1-year period. My question is, like, looking at the IRS things and paperwork, like, we have a fiscal sponsor, but we haven't done paperwork for the first year because we just started last year in January, and this we celebrated our first year, and we've done groundwork, and most of our questions do fall within the top 3 tiers. So my grant writing and things are pretty much in shape, but my question is about paperwork and partnership. Like, for now, because we are new, nobody wants to kind of partner with us. They're like, how much is the money? And that makes me suspicious. You're running after money, but we have a cause for which I'm applying, you know. So is it okay that I'm not very particular, I don't define, or maybe I am not able to figure out who should I partner with, but it might come eventually when I start implementing those, you know, in the 6 months period time that I figure out, okay, this organization could be good to partner, okay, this might not work. So that is my one question.
You know, I would say that, you know, we're happy you're here. It is a requirement that there be at least 2 partners in the submission of the grant. Now, the city does not directly playing a role in terms of putting those partnerships together, but there will be time. I just really recommend that you or anybody else in the room try to introduce yourself to other peoples in the room so they understand, you know, because somebody could be a partner because of the, you know, the access to a population that's an important population, and others, it may be because of the service delivery or whatever. So I would just encourage you. We can't put that together. You can't apply by yourself. I want to be clear with that. You need to have a partnership as at least 2 organizations. You can see the requirements that we are requiring, at least to be a partner or a lead organization. So I would just encourage you to try to reach out to other organizations in the city over the next month to see if you can engage in a partnership.
Okay.
And yeah.
If I can add one other thing to that as well, which might be in response to you, and others may be thinking of it as well, there is a definite distinction between partnerships and lead partnerships, so that there are different requirements for lead organizations. And as I was speaking of the documentation and the fiscal responsibility, that is a requirement for a lead organization. It doesn't ask for that same level of documentation for other partners. It does ask, you know, to be, excuse me, we do ask for additional buy-in and documentation overall and commitment, but when we get to the fiscal documents, that's really related to the lead partner. Hold on one moment. We're going to need you to speak into the mic, please.
Yes, I understand. Would you need to be a 501c3, though, even to be a partner?
So, thank you for the question. So we actually, not to criticize you in any way since there's so much information, I just want to point out, and we have this in the back of the room, we actually answered that question because it is a question that's coming up. Yes, you need to be the lead partner. You must be a 501c3 physically located in the city of Cambridge. To be a partner, but not a lead partner, you do not have to be a 501c3. So, so a lead partner can partner with an organization that might not have 501c3 status, but that actually has access to the families, or that answer. That is what we were trying to answer in our December 13th answers.
The other thing I would add to your question is, again, as Lisa mentioned, we are limited in the role that we can play in bringing partners together, but we have posted on our website the list of individuals and their organizations who were present at the November informational meeting. We'll be doing the same today. So I can show you where on our website it's located, but if you're just want to get a sense of who's been attending these meetings, who's been involved in this process, who could be worth reaching out to. We have that information available.
Thank you. The one thing that wasn't clear is, can you be a lead on one project and a partner on other projects?
Yeah, I do. You can only be a lead on one. You can be a partner on multiple. So I believe that you can be a lead on one, but you can be a partner on multiple.
Come on, stretch it. Hi. I have a question about the targeted population, which is children and families, which I applaud. However, our partnership is struggling a little with a focus on those with substance use disorder who are often disrupted from families and present as single individuals who then you hope to connect back to families. So I'm just trying to figure out how that fits in, or if it fits in with your vision for this.
It's a really interesting question, Kathy, that I don't think that we have exactly wrestled with. We were clear that for this round of the funding that the focus was families as opposed to individuals who might have a connection to a family. I think maybe to be crystal clear, we should take the opportunity to think a little bit offline to make sure that we're not giving you a definitive answer without having a chance to talk about it. But I do think that we certainly wrestled with the fact that there are many individuals who are experiencing the needs that we identified as the top tier needs, but they were not the focus of this round of the RFP. But let us take a little offline time and then we could answer that question.
Anything else? So this is not, as we said, the last opportunity for questions. So please, I think you have it in the handouts, but make note of the email on which you can pose additional questions. Really want to thank you all for being here. We are so excited about this grant and being able to move forward on this. So we look forward to the next phase. Last call for questions? No? Okay, thank you so much.